Yo, what it do? It's your boy Bruce. I'm back here with another YouTube video, so y'all already know what's going on. So today what we do, we learn a little bit about that oxycodone. So I'm kicking knowledge. All right, so what we know about oxycodone, chat. We know oxycodone is an opioid analgesic, and it's a level 2 scheduled drug. So what we know about scheduled drugs, them is the ones that's high potential for drug abuse, addiction, and overdose. So it's critical to take this medication exactly how the doctor prescribes. So if it's 5 milligrams, it's 5 milligrams. If it's 10 milligrams, it's 10 milligrams. And there is no refills. Doctor got to re-prescribe this because it's a scheduled drug. All right, so what do we know about this drug, chat? We know that it's used for severe pain, to relieve severe pain, and it works in the central nervous system. It alters the pain perceptions and increases the tolerance. So it helps improve the comfort level and the rest and the mobility, and participated in care. So if this patient was coming out of pre-op, just had surgery, and they have to do some type of stretching, some ROM, some physical therapy. So we most definitely want to give them the oxycodone before they get down there so they can feel a little bit better, so they can start moving that body around. So we got the benefits, like I said, it's for severe pain and help improve ability of functioning, and reduces anxiety, And then we got some risks. The risk right now, we got that constipation. All right, so the patient gonna be backed up. So we're gonna most definitely gonna push fluids. We're gonna push fiber, and we might even suggest a stool softener. And the most serious thing that's the risk that we got is the respiratory desperation. So if they low, if they under 12, we holding it. We not even going past that, because this, like we just said, this is going to go to the central nervous system, and it's going to slow everything down. So we don't want to slow his heart rate down if we already at 12, right? Got me, chat? So like that, those is the risks and the adverse effects is sedation, confusion, dizziness, nausea and vomit, All right, so with safety concerns, things that we're gonna have to look out for because we didn't pass this medication. Now we need to know that this patient needs to avoid alcohol. This patient needs to avoid all the benzos and central nervous depressants, and the patients that are fall risk because it's sedated. You hear me? And we don't want to crush or chew this extended release tablet, So we're gonna keep it just as whole, pop them, bam, give it to them like that, just like that. All right, so patient teaching. Well, the purpose is, to, help you with your pain, and we definitely want to take it with some food to, prevent the nausea and prevent. When you change the positions, you want to change positions slowly because you're dizzy, and you don't want to just have that hypo, where your blood pressure falls when you be moving too fast. Like I said, we're gonna expect constipation, so I can't say that word right now. So I'm not really doing no retakes. So if you're not feeling this, it's just so we're gonna increase fluids, we're gonna push fiber, and consider that stool softener. Before administration, like I said, we're gonna hold if it's that respiratory rate is below 12, and we're gonna check that level of consciousness and check that pain score. So if that pain score is the 1 to 3, he on the mild, what I'm saying? He like on that 3 to 8, he on that moderate. So what I'm saying, this is for severe, so he gotta be on, that's pre-op, he in pain. So that's that 8 to 10. After we didn't give the medication, we're gonna reassess, check that pain level again, make sure we're gonna keep the lights dead. We're gonna check for that pain level again, make sure that pain level is straight, so that pain level, bring that down, and we're gonna check his area, make sure he's not at for no fall risk, he or she. So that's the teachings about oxycodone. If you want to do administration, you definitely want to follow the 6 rights of drug administration. That's right drug, right dose, right patient, right route, right documentation, and right time. You know what I'm saying? So we're going to follow all the instructions how it's supposed to be done. You hear me? All right. So if you have any questions, if you had got an order, you didn't know what was happening, you always want to refer to your handy dandy nurse's drug handbook. So All right, chat, here we go. Demonstration. Knock, knock, knock. Hello, how you doing? My name is Bruce. I'm gonna be your nurse today. I'm here to check your pain level. Are you okay?
No, Bruce, I'm not okay.
Okay, what's the matter with you? You feeling any pain anywhere?
Yes, my pain level is probably about 8.
Oh, okay. So I see you just got out of pre-op, so I'm gonna go ahead and check the MR and see what they got for you. The nurse already checked your vitals, so I'm gonna see what they got for you.
Yes, you already checked my vitals.
All right, so we see that pain level at an 8, so we're gonna check the MR. So you got it available. The doctor prescribed 10 milligrams of Oxycodone if the pain level is between 8 and 10. Hold if the respiratory rate is under 12. You check the blood pressure, vitals, everything is good. So she all looking good. We're gonna wash our hands and administer and prepare to administer this medication. All right, knock, knock, knock.
Did you give me something?
Yes, I need to go ahead and check your wrist real fast. Okay, Mrs. Carla, you're doing good. All right, so got the right dose, got the right medication, got the right patient, got the right time, and after this, I'm gonna document that. Here you go. Here's your medication. Let me give you some water with that.
Thank you.
All right, cool. How you feeling?
I'll check.
All right, let me see. All good, all good. So you got your medication. I'm gonna come back and reassess you in about 30 minutes, check your pain level, and your blood pressure, and your body.